All right, thank you, Linz. Let's take another live look at the White House this morning. President Trump is back there right now after getting treatment for his coronavirus COVID-19 infection in a hospital for about 3 days.
So this morning, Dr. Dana Hawkinson, University of Kansas Health System, joins us live to talk about the president's condition. Doctor, obviously, we want to make clear this as we begin this questions this morning. We know that you're not treating the president. We know that you're not familiar with the exact specifics of his case. We don't want to make people think that we think that or you're inferring that in any of your answers. But help us clear up some of the confusion here with his timeline is when he tested positive, when a person tests positive, and when they are cleared for coronavirus. We know it's been less than a week since we heard of his positive test, and now we see him going back to the White House, taking off a mask. How do you kind of compare that to the timeline that you've seen with your patients?
Yeah, you know, I need that rocket lift off for all my segments.
Yeah, you do.
Opening all my segments.
Yes, you do.
You know, certainly for the CDC guidance for discontinuation of isolation, if you are diagnosed with COVID, it's either 10 days from the diagnosis date or 10 days from your symptom onset date, really whichever is longer, because if you get diagnosed and then 2 or 3 days later develop symptoms, you use that symptom onset date as the 10 days that you need to take before you can discontinue isolation. What we do see with people in our hospital that have come in other hospitals, really the natural history of disease is people will get the initial infection. That's when the virus is replicating. That's when your immune system is starting to decrease the amount of virus in your body. They will feel better, but then we have to look towards that 7, 10, 12, 14-day mark after that, that's when you can have the cytokine storm that everybody is familiar with, the ARDS or the respiratory failure that everybody is familiar with, and the immune dysregulation. And that's when really your immune system is kind of going into overdrive, dysregulated, not doing things properly, essentially.
So if you make it through that day 14 without that cytokine storm, is that in general considered to be okay? You should probably not have a relapse of some kind?
Yeah, you know, I think in general, yes, that is true. There are always the outliers. Really, more of that 14 to 21 days, we want to really watch what is happening after that acute infection, when your body is now dealing with the ramifications of that infection, when your immune system could have that dysregulation. Now we are understanding that people can even have, adults can have that multi-system inflammatory disease that we've seen in children as well. And so that tends to happen more of the 3 weeks out, the 21 days or more out. So I don't think you're really out of the woods. If you can continue to feel better, that's good, but really pay attention for, you know, up to that 14-day mark and maybe a little bit past to see if you start having any other complications.
Doctor, as always, we know that the president is very active on Twitter, and he's been using Twitter throughout his diagnosis and stay at the hospital to give video updates on his progression through this fighting off the virus. He shared another one when he got back to the White House last night. We want to play a clip of that.
And one thing that's for certain, don't let it dominate you. Don't be afraid of it. You're going to beat it.
So the president has said, Doctor, that he wants to try and be uplifting. He wants to try and give a positive message. You guys do the calls every morning. We share those on our Facebook pages. We've had lots of viewers that are watching now that have heard you say similar kinds of things on those calls about, you know, the coronavirus is not going to take you out if you act appropriately. You can react appropriately to this virus. How do you compare what you're telling people with what he says there about it? Don't let it dominate your life.
Yeah, I think since we have been doing this from day one, we have always said we don't want to come at the audience from a direction of fear. We want to provide you with knowledge. We are absolutely acknowledging that this virus is horrible. It leads to morbidity, which is very bad illness, but it leads to mortality as well. And there are 200,000 plus excess deaths that would not have occurred in this country because of COVID-19. There are many people who are continuing to suffer even though they've gotten through the disease because of COVID-19. So I think the message that we have tried to give is that if you do these things, if you adhere to public health guidance and do these very important things that initially seem hard but then later become like second nature, that is mask wearing, that is distancing, not gathering in large groups as we did in 2019. We would all like to do that, but right now we can't do that because this is a very real entity. We don't want you to be fearful and act out of fear. We want you to act out of knowledge and know that you can do the best things to decrease the risk of getting it, decrease the risk of you and your loved ones and your friends getting it. But you do have to be vigilant, and you do have to understand that it is a very real entity. And those numbers, 200,000+ people who have died, they aren't just numbers. They are real people, and they are mothers, fathers, children, sons, daughters, grandparents. So if we come from a side of knowledge to understand really what is going on, that is the best way moving forward. That's what we continue to do every day.
Absolutely, Doctor. Thank you very much for joining us this morning.